Dr. Zelenko, how are you?
I'm great. Thank you, Mr. Mayor, for having me. So currently in America, hydroxychloroquine and azithromycin are being used in many ICUs with some moderate success, mild to moderate success. And the reason why is very simple. When a patient is in the ICU, most likely they're intubated from a condition called ARDS, acute respiratory distress syndrome, which is a completely different animal than the coronavirus. It's a disease in itself. It's basically the lungs are eviscerated and destroyed from within because of the body. Well, the problem was the test took 3 days to get back.
And that could be, particularly for a very, very difficult case, that could be a critical 3 days, right?
Yeah, that's the main point, that we need to hit hard. We need to hit this infection hard and early.
And the earlier you hit it, the better the success, even for a compromised person?
Especially in a compromised person.
Well, give me the results. They're your results. You should be the one to put them out. What are your results, doctor?
And I'm about to publish those outcomes. I've had 0 patients die.
0 die.
0 patients intubated.
Yep.
And I have currently 3 patients admitted in the hospital with pneumonia, but they are not intubated, and I think they'll be fine.
And this is after treating
hundreds.
Could you just give me sort of the best approximation of hundreds? 500?
I think 450, 500, something like that.
450 to 500. Are you treating people right now as we speak?
Yes.
Is the number declining or increasing, or?
Increasing, actually, because I'm the only doctor that seems to be doing it, or one of the first, and if not the first. And so when this became public, the whole world started calling me.
So are you going beyond now treating people in Curious Joel?
Yes.
So of that 400 to 500, were they all Curious Joel, or were they people that might have come in just to visit you after they heard about it?
So a third are from outside the community.
About a third. And those are people who heard about it through word of mouth or whatever, right?
Yes.
The people that are being treated, are some of them still suffering from very difficult symptoms? I mean, is there a gradation of what you're seeing from very serious symptoms to very minor symptoms?
Yeah, well, I don't treat people with minor symptoms unless they're extremely high risk. Can I give you my parameters?
Of course. That's what we want. Yep.
And this is to the American people. If you're young and healthy, you'll be fine.
The parameters are, if you're young and healthy, you'll be fine.
Your immune system is strong enough. Statistically, it's been proven you will recover. You may be miserable for 2 weeks, but you will recover. You'll be fine.
Your immune system, all by itself, unaided by anything, will defeat the COVID.
Statistically, that's been the case, yes.
Would you prescribe something for these young people to help them with that?
At this point, I don't, because the medication is not a candy. It does have side effects. So I have to have a good reason. You know, everything in life is a risk versus benefit analysis.
Have you varied that with any of the young people so that you did treat them?
Yeah, well, there are young people that have illnesses.
Well, of course. So if a young person has compromises to their immune system,
yeah, sure,
they're going to be almost in the same situation as an older person.
Exactly. That's a different. That's why I said young and healthy. I define young less than 60.
Pardon me?
When I say young, I mean less than 60 years old.
Okay. Less than 60. And have you had any of those? Yeah, less than 60. No other problems. Have you had to give medicine to any of those because the symptoms were so bad?
I have. People were begging, and in clinical medicine, sometimes you have to make exceptions.
Of course, right. But you're quite convinced that in the vast majority of cases, these people are going to win the battle based on their immune system.
That's well-established fact.
Okay, so now go on the rest of the protocol.
So now you have anyone who has shortness of breath, regardless of their situation, I'll treat, because that's a dangerous symptom.
So even for a young person, if they had shortness of breath, you're going to go right to the
I'm going to hit them hard.
You're going to hit them hard. You're going to hit them hard with the hydro, with the Z-Pack, and with the zinc. What do you give them of Zithromax?
500 milligrams, 1 pill a day for 5 days.
And then what about the hydroxyquinone? How much of that do you give them?
I use hydroxychloroquine, 200 milligrams twice a day for 5 days. That is a slightly lower dose than what is being used in the ICU. In the ICU, the first day they use 400 milligrams twice a day, and then they go to 200 milligrams twice a day. What I do in the outpatient setting is use the lower dose of 200 twice a day from the very beginning. For now.
Why do you do that?
Because this is the art of medicine. We want to have maximum benefit with minimum side effects. So I thought that since these patients are not critically ill, it's reasonable to use more moderate dosing.
Would you change that if you saw very serious symptoms?
I'm actually, this is all, please, Mr. Mayor, you have to know that this is all new, and I'm developing this stuff as I go along. This is like battlefield medicine. I'm giving you a report from the front line.
And I really appreciate this, that you're doing this. You're really helping a lot of people. But I guess the question was, are there any times you vary that 200 milligrams?
I'm beginning to vary that. Well, I haven't yet, but I want to vary it in the older population that are sicker, because I think they need to be hit harder to prevent them from going to the hospital.
And the zinc, is there any dosage of that you would?
I use 220 milligrams.
And how often?
Once a day.
For 5 days also?
For 5 days.
The treatment, so the actual cost of the medicine is $20?
Yeah, and that's very important because you can scale that nationally. If every treatment costs $20,000, that's not so good.
That's for the 5 days of these pills?
Yeah. Because they're old pills. All I'm doing is repurposing old available drugs, which we know, and we know their safety profiles, using them in a unique combination in the outpatient setting.
This is the $20 treatment.
Yes.
And with medicines that have been used forever.
Yes.
And we know the side effects of the medicine.
Yes.
What's the worst side effect? Dr. Zelenko, how are you?
I'm great. Thank you, Mr. Mayor, for having me.